I'm Professor Rich RN. I'm a professor in the School of Nursing. I'm also an NCLEX coach. Today, my goal is to walk you through a case study that will help you utilize the nursing process, but also help you kind of analyze some things that you're going to find on the NGN or Next Generation NCLEX. So this is going to be a very important piece or study tool for you as you prepare for that or while you're in nursing school. So let's go ahead and jump right in. So we have a case study here. We're going to use the nursing process in our clinical judgment to evaluate a patient by the name with initials of MK. It's a 78-year-old male. MK is admitted to the hospital with congestive heart failure, an EF of 15%, and a BNP of 3,000. Vital signs are 38.2. Heart rate is 104. It's irregular. Respers are 28. We've got a BP of 162/54, O2 at 89%, and 6 liters. We have our assessment is anxious, restlessness, coarse crackles throughout, AFib ANO times 4, plus 2 pitting edema in the lower extremities, and reports pain of 4 for a headache. Now I want you to look at this, use your clinical judgment just based upon this assessment that you just got. Okay? What do you think is going on and what would be your main priority for this patient? So give it some thought. Pause the video if you need to. Before we move to the next piece, I want to show you, and I will give you the answer to that as we work my way through this, okay? I want to point out a couple things in case you're unfamiliar here. We have an EF, that stands for ejection fraction of 15%. We usually, anything below 40 is not doing well, okay? So this patient has pretty severe congestive heart failure. We have a BNP, which is a brain natric peptide of 3,000. That is a hormone that is released with the stretching of the cardiac tissues. And so that also is very, very high. We typically will find it less than 100. So it is extremely high. So this patient is undergoing at least an exacerbation of the heart failure among some other things. So as we continue, I just wanted you to be aware of what those were. So vital signs review. Systolic blood pressure should be less than 140 or 120. Hypotension is less than 190. Typically, we have a heart rate, a range of 60 to 100. Less than 60 is bradycardic. Greater than 100 is tachycardic. Respiratory rate of 12 to 20. Less than 20 is bradycardic. And then greater than 20 is bradyapneic as well. Okay? So now we're going to look at this case study in the form of using that nursing process with the help of our clinical judgment critical thinking. So first, we do our assessment, ADPIE. A is the first piece, right? So we already noted both subjective and objective data on that last photo I showed you, okay? We have the vital signs, and then we have our assessment, okay? What we can tell from this information is a couple things. Hopefully, we determine they're having the exacerbation of the heart rate. But even more than that, the main priority here is dealing with respiratory. They're having respiratory issues, okay? And we can tell that by a variety of things, and we'll get there. But first, I want to ask you this question here. What type of heart failure is this patient demonstrating? Left, right, both, or neither? Give that one some thought. Okay, so the correct answer is going to be both. So left-sided heart failure is going to back up fluid into the lungs. Remember, coarse crackles are present in this patient, so that one's there. They also have +2 pitting edema, so therefore that one is also present. So therefore they're experiencing both left-sided and right-sided heart failure. Okay, so the diagnosis, or we're coming up with that nursing problem as part of our ADPIE or nursing process. So we did the A, now we're on the D for diagnosis. What's the most appropriate priority nursing diagnosis or problem for this patient? Is it pain for that headache? Probably not. Is it at risk for a fever? Hopefully you didn't pick that one. Ineffective breathing pattern? Yes, that is the one you should have picked. Why? Airway, breathing, circulation. Airway, breathing, circulation. Always airway, breathing, circulation. Anxiety, yeah, they have anxiety and we can deal with that, but the priority assessment is immediate. If we don't deal with it, it's going to cause immediate harm to our patient. So therefore, infective breathing pattern is the correct answer. Okay, so you might have said, well, Professor Rich, how did you come up with that information? How do we know it's infective gas change and infective airway and we're having a major respiratory issue? Okay, well, let's go back to the case study. All right, so now we're looking at the case study. Let's look at this again a little bit deeper now. So let's look at those vital signs. What sticks out? Okay, well, temperature's a little high. Heart rate is high. All right, heart rate's high. A lot of things can cause the heart rate. The pain could cause the heart rate. The temperature could cause the heart rate. The anxiety could cause the heart rate. But low oxygen also can cause that heart rate. So keep that in mind. All right, respiratory rate. Oh boy, that is 28. 28. Very high, okay? That is very high. That means they're definitely not getting enough oxygen. So what is happening? The body is compensating. The body is compensating by having us breathe more so it can transfer or perfuse that oxygen to our tissues. Blood pressure, also a compensating mechanism as well. And then if we go back to that heart rate, which is elevated, again, that's why. It's not really elevated, or it could be elevated because of some of those other things, but primarily it's going to be elevated because it's trying to compensate by the low oxygen that is present with this patient. Let's also look at that 89% SpO2 on 6 liters. It's not good. So clearly this patient is having hypoxic event, okay? We look at our assessment. Anxiousness and restlessness, those are also very important for us to identify as early warning signs of hypoxemia, okay? So NCLEX might have not asked you it in the way I did, but it might have said, what are some early signs of hypoxemia that you'd have to highlight? And you'd have to highlight those, right? I gave you all that information with the vital signs for you to help put the picture together of why they're having respiratory distress, hypoxic issues. So, nursing process, what are we going to do? We got to plan. We got to come up with a goal, and we got to come up with interventions that are going to help this patient improve their respiratory status. So, all right, a few of them we can come up with. Elevate the head of the bed. We can increase that oxygen rate. We can administer prescribed medications. Probably Lasix, furosemide, right? That's a very common medication to give someone who has fluid overload and has edema. It's going to pull that fluid not only from the body, but from the lungs as well, and help that patient breathe better. We're going to do strict I's and O's, daily weights. We're going to educate on maybe a low sodium, educate on the fluid intake, a bunch of things we can do as our interventions for this patient. So let's make a goal, okay? The goal is the patient will consume no more than 2,000 mLs of liquid per 24-hour period. And that is our fluid restriction that the doctor ordered, and that can be one of our goals. A second goal that we could come up with for this patient would be, patient will maintain an effective breathing pattern with normal respiratory rate, depth, and oxygen saturation during the nurse's shift. Okay, those are all SMART goals, meaning specific, measurable, attainable, realistic, and timely. Okay, we can utilize all of those. All right, next, implementation. Let's just look at this question here where it says, which intervention would you perform first as the main priority? All right, would you administer 650 milligrams acetaminophen Tylenol for a fever? Number 2, educate the patient on the MD orders of 2,000 milliliters fluid restriction. 3, replace the nasal cannula with a face mask and increase oxygen levels. Or 4, administer an antihypertensive medication called metoprolol or Lopressor, 50 milligrams PO. So give this one some thought. Pause the video if needed. Which one would you be your main priority? All right, so this one, the main answer you should have chose was number 3 or C, replace the nasal cannula with a simple mask. Why? Well, let's remember that nasal cannula, the clear tubing, only goes up from 1 to 6. Okay, we can crank that thing up to 7 liters, 8 liters, but it's not going to be able to deliver that additional oxygenation. Okay, it's only good for 1 to 6. A simple face mask, we can go from 5 to 8 liters. A non-rebreather mask, we can go from 10 to 15 liters. And then a high flow nasal cannula. Now remember, the difference on this one is that the high flow is a much thicker tubing and is traditionally going to be a green color. That high flow we can turn up to 15, but the patient was not on high flow, they were on regular nasal cannula. So we would put them on the mask if we're looking for that question. So I want to reemphasize early signs of hypoxia. We mentioned restlessness, we mentioned confusion, anxiousness, and shortness of breath, hyperventilation, tachycardia. Those are your early signs of hypoxia. So we got to get in there and fix the problem stat. Now, if you make it to the late signs, we're in some trouble, okay? Here's your late signs. Hypotension. So we've gone from hypertension to hypotension, not good. We've gone from tachycardia now down to bradycardia, not good. We've also gone to cyanosis, so we're gonna get some bluish. Maybe it's usually kind of be in the lips, the face, and continue to grow outward. So those are your late signs of hypoxia: bradycardia, hypotension, and cyanosis. All right, so that last piece of ADPIE, remember, ADPIE is assessment, diagnose, come up with a nursing problem. P for planning, I for interventions or implement, and then E for evaluation. We got to evaluate those things, okay? So remember, we had 2 goals, and we got to look at those goals. So the 2 goals, just to refresh your memory, was the patient will consume no more than 2,000 mLs of liquid per 24-hour, meeting the fluid restriction. We're still on shift, so that's an in-progress goal. Second goal, patient will maintain an effective breathing pattern with normal respiratory rate, depth, and oxygen saturation during the nurse's shift. Again, we're still on shift, in progress. So we evaluated our 2 goals. But guess what? Now we get to reassess them all again. And why do we want to do that? Because we gave a bunch of interventions, okay? So we want to do our assessment. We want to still see, are they still having, is that respiratory issue still their main priority, or has it changed to something else? So the nursing process starts again. Now, I want to talk about part 2 of this case study, because in real life, we don't just do a couple interventions and the patient miraculously recovers, right? There's always more, always more, always more, okay? So in this second piece, you can see on the screen now, we have implemented our fluid restriction, our strict I's and O's, low sodium diet. We gave Lasix IV 40 milligrams BID, and we gave metropolol to help control that blood pressure of 20 milligrams. So it's been 6 hours. So our vital signs now we have a temp of 37, heart rate of 92, respiratory rate of 20, BP of 112 or 50, O2 of 93% on 12 liters, a high flow. So we switched them from the mask to a high flow. Assessment, still anxiety, coarse crackles throughout, +3 edema, and ANO times 4 with them. Now we noted a red and coccyx as well. So by looking at that data, okay, take a quick little look. The question now is it helping? Okay, we're reassessing. Remember, we're doing the nursing process all over again. Is it helping? Well, let's look at those vital signs again, okay? Remember, the heart rate was tachycardic before. Now it's 92. It's in with normal range. So that kind of means that the body's not compensating like it was. Seems to be helping. Respiratory rate's 20. It's back within normal range. Again, body's not compensating. What we're doing seems to be working. O2 saturation is 93%. We wanted above 92% for this patient per our protocol. So again, that's working. We're on 12 liters high flow. So we don't have any early signs of hypoxia right there. We do have some with anxiety a little bit, but we don't really know what that is going to be related to. Okay, so overall, this patient does seem to be getting better, which is great news. So remember, in real life, it's been 6 hours for this patient. We gave only 1 dose of Lasix. We've increased their oxygen. We've done some other interventions. We decreased some fluid, but they're getting better. We don't expect them to all of a sudden be back to baseline like before they were to come in or even started having this ailment. So we're improving. It's going to take some time, but we're going to continue that nursing process over and over again to see what we can do and what our priorities will be, because they might change depending on the situation. So I hope this case study worked for you guys, and it helps you prepare for the NGN and also understand how we utilize the nursing process and how important that is. Like and subscribe. Hope you have a wonderful day.